Hello everyone, welcome to Nurse Bestie Explains. Today we see a topic from the obstetrics and gynec syllabus, that is Hyperemesis Gravidarum. Coming to the definition of Hyperemesis Gravidarum, it is a severe type of vomiting of pregnancy which has got deleterious effect on health of the patient, that is the mother, pregnant mother, and or incapacitates her day-to-day activities. So what is hyperemesis gravidarum? It is hyperemesis. Emesis is vomiting, hypervomiting, increased vomiting frequencies. Okay, it is a severe type of vomiting during pregnancy which has got a deleterious effect on health of the patient, that is pregnant mother, and or incapacitates her. Okay, it makes her difficult to perform her day-to-day activities. That is called as hyperemesis gravidarum. Or hyperemesis gravidarum is characterized by severe nausea, feeling of vomiting, and intractable vomiting sufficient to interfere with maternal nutrition. Okay, usually one or two vomitings are okay, maximum 3, 4, 5 vomitings are okay, but more than that, vomiting for more number of times which interfere with maternal nutrition or nutritional deterioration will be there, causing deleterious effect on her health. Her health and her nutritional status will be affected, which is interfered because of the severe nausea and intractable vomiting. That is called as hyperemesis gravidarum. Prevalence is, according to the National Health Portal, 0.3% of to 3% pregnant women, 0.3 to 3% of pregnant women suffer from hyperemesis gravidarum. Commonest indication for hospitalization in the first trimester of pregnancy. This is the common cause for mothers getting admitted into the hospital during the first trimester of pregnancy. The common cause is hyperemesis gravidarum. Okay, so hyperemesis gravidarum, extreme morning sickness. We, in general common words, we call it as morning sickness. During pregnancy, feeling of vomiting early in the morning, we call it as morning sickness. 70 to 80% of all pregnant women experience some form of morning sickness during pregnancy. Hyperemesis gravidarum is hyper, that meaning excessive, emesis meaning vomiting, and gravidarum means a pregnant woman. Okay, hyperemesis gravidarum, excessive vomiting among pregnant women. That is a condition which involves extreme morning sickness, including nausea, vomiting, and weight loss. Because it continues for 2 months, 3 months, like that. In some mothers, it continues more than that, which leads to weight loss as its major symptom. It is thought to be a result of high levels of pregnancy hormones, but the exact cause is not known at this time. Coming to the etiology of hyperemesis gravidarum, it is limited to the first trimester. Okay, mostly in most of the mothers, they suffer with this in the first trimester. Most common in first pregnancy. Okay, when the mother is pregnant for the first time, hyperemesis gravidarum is commonly seen. In subsequent pregnancies, the reoccurrence will be less. Tendency to reoccur again. Okay, again they may get in subsequent pregnancies, or for second pregnancy they may not get at all. Okay, familial history. Mother and sisters also suffer from the same kind of problem during pregnancy. More prevalent in hydatidform mole and multiple pregnancy. Okay, hydatidform mole in the uterus. Okay, hydatidform mole condition and multiple pregnancies. Okay, and common in unplanned pregnancy, the pregnancy which is not planned. Okay, unexpectedly mother becomes pregnant. Those pregnancies also hyperemesis gravidarum is common etiology. Okay, then risk factors. Mothers age below 17 years and over 35 years are at risk for this. Primigravida, first time she is pregnant, carrying a baby with multiple pregnancy. That means twin pregnancy or more than that. Triplets, quadruplets, like that. Okay. Underweight and obesity. Mothers who are underweight and obese mothers. Okay. Less and extreme conditions. Psychological factors such as unwanted pregnancy. They don't want to become pregnant. They are not ready to carry a baby, or marital problems if they are facing marriage related issues, and a history of hyperemesis gravidarum. So previous history of mothers or sisters having the same problem. They are the risk mothers. There are some theories related to hyperemesis gravidarum. First one is hormonal. Okay, that is the exact cause is not known. Maybe some cases it may be hormonal, high HCG. Okay, in cases of identiform mole and multiple pregnancy, more than one baby, one fetus, those cases high HCG levels may be the cause. High estrogen level, increased incidence in high OCP users, okay, estrogen progesterone users. High progesterone levels, relaxation of cardiac sphincter relaxed in high progesterone patients, which leads to vomiting. If cardiac sphincter is loose, okay, the relaxed, easily whatever food we eat, easily patient will vomit. Other hormones involved are thyroxine, prolactin, leptin, adrenocortisol hormones. Another theory is first one is hormonal, second one is psychogenic. It probably aggravated nausea. Once it begins, it triggers neurogenic elements. Once the nausea comes, it triggers the neurogenic elements, that is psychogenic, followed by vomiting, frequently vomiting. Then dietary deficiency, probably due to low carbohydrate reserve, as it happens after a night without food. Okay, due to low carbohydrate reserve, if last night the mother had no food, proper food, it she may feel nausea or vomiting in the morning. Deficiency of vitamin B1, B6 and protein may be the effect rather than the cause. It may affect allergic or immunological basis. A decreased gastric motility is found to cause nausea. Okay, these are the theories. Signs and symptoms of hyperemesis gravidarum are vomiting throughout the day. Throughout the day, multiple times, 10 times more than that. Also, mothers will vomit. Normal day-to-day activities are disturbed. Because of this vomiting, she cannot do her day-to-day activities. No evidence of dehydration and starvation. Okay, late. Evidence of dehydration and starvation also will be. Some cases very lately you will identify. Some cases dehydration and starvation is clearly observed. Coming to the investigations, urine analysis. Urine testing has to be done first to confirm. Okay, usually some mothers will not keep the record of their last menstrual period. Okay, they don't know that they are pregnant because of the feeling of nausea and vomiting. That time when they go and check with the menstrual date or they go for urine testing, that time pregnancy will be confirmed. Okay, so urine analysis has to be done. Biochemical and circulatory, HCG and any hormonal increased progesterone or estrogen hormones, those levels also that has to be monitored. Ophthalmoscopic examination has to be done and ECG. Because of dehydration, ECG has to be conducted, okay, to check for any differences. Coming to the diagnosis, pregnancy should be confirmed first. Okay, first confirmation of pregnancy. Associated causes of vomiting are excluded. After confirming the pregnancy through scan and HCG blood serum HCG levels, if it is not pregnancy, identify for other causes. Okay, gynecological or medical or surgical causes you have to identify. And you can prescribe ultrasonography to confirm pregnancy, or hydatidform also you can confirm in ultrasonography, and multiple pregnancies also you will come to know. Okay, more than one fetus. And how this hyperemesis gravidarum is going to affect the fetus. Okay, because of this hyperemesis, already mother will be malnourished because her nutritional status will be diminished. So how it affects the development of fetus? Let's see that. The effects of vomiting on the fetus depend on the severity of vomiting. Mild to moderate vomiting does not have any effect on the fetus because mild to moderate are okay. 5 to 6 vomitings a day. Mother will keep on hydrating herself, eating the nutritious diet, then it will be okay. But hyperemesis, okay, too much excessive vomiting leading to weight loss of the mother can cause fetal growth restriction. Fetus growth will be restricted. Weight cannot be gained in one-third of the fetuses. In one-third of the fetuses, fetal growth is affected. That's how it is going to affect the development of the fetus. Coming to the prevention, import effective management to correct simple vomiting of the pregnancy. So first itself identify and take proper management measures has to be followed so that severe excessive vomitings can be prevented. Coming to the management, okay, treatment for hyperemesis gravidarum. First thing is hospitalization is very important because mother will go into dehydration, which may affect the fetus also. So admit the patient first, open IV line and correct the fluids. Okay, fluid replacement has to be done. Send for relevant investigations, any hormone investigations or confirmation of pregnancy. Have to correct the fluids and electrolyte, serum electrolytes has to be monitored. And maintain an intake and output. IO chart has to be maintained, monitor urine output, catheterize the patient or measure the urine output. So, and you have to maintain IO chart. Monitor the vital signs frequently, test the urine periodically for ketone bodies. Okay. Then oral feeding. Once the patient fluid status is stabilized, oral feeding is withheld for at least 24 hours. Stop the oral feeding, nothing by mouth for 24 hours after the cessation of vomiting. Once the vomiting stop, until 24 hours, do not allow her to take anything through mouth. During this period, fluid given through IV drip method. Okay, IV fluids can be given. The amount of fluid to be infused in 24 hours is calculated as total amount of fluid. How much? For example, 3 liters you want to replace, of which half is 5% is dextrose and half is Ringer's ravi. Okay, 1.5 of 5% dextrose, 1.5 liter of Ringer's solution. You can extra amount of 5% dextrose equal to the amount of vomiters and urine in 24 hours. 24 hours, how much urine they are passing, how much volume of vomiting they are vomiting, that you measure. According that amount you have to replace exactly. It is to be added. These measures help to correct dehydration, electrolyte imbalance and ketoacidosis. Okay, this can be very nicely handled. After that, enteral nutrition through nasogastric tube may be given. After once the patient is stabilized, you can allow them to take a nasogastric tube feeding can be given. Next, coming to the pharmacological management. Anti-emetic drugs are given like promethazine 25 mg IM twice or thrice a day. Trifluoropromazine 10 mg IM intramuscular, metoclopramide 10 mg intramuscular. Hydrocortisone 100 mg IV in the drip. You have to add to the IV drip. Prednisolone orally. Nutritional support, vitamin B1, B6, B12 and vitamin C tablets supplementations has to be given. B1, B6, B12 and vitamin C. Okay, that is the pharmacological management and hospitalization. Coming to the nursing management, important part of our nursing care. Nursing diagnosis for hyperemesis gravidarum are fluid and electrolyte imbalance. First of all, due to vomiting, mother is under dehydration. So, fluid electrolyte imbalance related to excessive vomiting or lack of fluid intake. Second nursing diagnosis is imbalanced nutrition less than body requirement related to nausea, vomiting or lack of nutritional intake. Imbalanced nutrition less than the requirement of the body because of nausea, vomiting, lack of nutritional intake. Third one, anxiety related to hyperemesis influence on the health on the fetus. Mother will have anxiety because if her condition is like this, how the fetus condition is going to affect it. Knowledge deficit related to lack of information. Some mothers, if they are pregnant for the first time, lack of information about the treatment of hyperemesis is also one problem. Knowledge deficit. Sleep pattern. Because of this excessive vomiting and dehydration, sleep pattern disturbance related to persistent vomiting, activity intolerance related to weakness. These are the nursing diagnosis for hyperemesis gravidarum. The interventions are promote resolution of the complication. Make sure that the client is nothing for oral until cessation, complete stoppage of vomiting. Administer intravenous IV fluids as prescribed. They may be given on ambulatory basis when dehydration is mild. That means if dehydration is mild, 1 or 2 saline they will infuse and send the mother to the home. Measure and record fluid intake and output. Encourage small frequent meals, snacks once vomiting has subsided. Once vomitings are completely stopped, small feeds at frequent intervals you can start. Administer antiemetics as prescribed. Second one is address emotional and psychological needs. Maintain a non-judgmental atmosphere. Do not judge that why it is happening in our family, nobody had this problem. That kind of judgmental statements Please do not stay in the room and pass these kind of judgmental statements. Okay. Atmosphere should be free, in which client and family can express concerns and resolve some of their fears. Okay. Then dietary management. Before IV fluids is given, oral small and frequent dry meals without fat should be given. Okay, once IV fluids are stopped, oral small and frequent intervals dry meals without fat should be given. First, dry carbohydrates like biscuits, bread, and toast can be encouraged. Ginger is helpful for nausea and vomiting. Gradually, full diet is restored. Gradually, as the patient is able to tolerate the simple diet, then you can full diet can be restored slowly. So this is about the hyperemesis gravidarum, hyper excessive emesis vomiting gravidarum during pregnancy. Okay, so that is about the hyperemesis gravidarum during pregnancy. Thank you for watching. Like and subscribe.